Clinical trigger point therapy uses two special client positions to enable the therapist to more easily access and release certain trigger points: the standard side-lying position and the extended side-lying position. The standard side-lying position involves having the client lay on their side, with the side to be addressed facing up. A few key points to ensure client comfort include: be sure to place a bolster or pillow under the client's top knee. Be sure to place a bolster or pillow under the client's head and neck. And cross the client's arms so that they don't hang off the table. The extended side-lying position is used exclusively to address trigger points in the quadratus lumborum muscle. To place the client in this position, perform the following steps. With the client in the standard side-lying position, ask them to extend their top leg and place it on the table. Next, assist them in bringing their bottom knee up near their waist. Next, bring their top arm up over their head and let it hang down towards the floor. And finally, use your hands to gently open the space between the rib cage and hip crest. Clients in acute low back pain will typically need assistance in getting on and off the table, and when rolling between the various positions on the table. The therapist should assist them by grasping them around the lumbar or waist region and stabilizing it while the client moves into the new position. While executing a trigger point release procedure, it's important for the therapist to elicit information regarding pain intensity from the client. Typically, this is done by asking the client to rate the severity of their pain on a scale from 1 to 10, 1 being no pain and 10 being severe pain. The therapist will use this verbal feedback to keep the pain produced by a pressure release technique within a tolerable range, usually from a 5 to a 7 on the pain scale. This is important because too much pain is counterproductive to the release procedure, and too little pain probably indicates that the trigger point is either not active or the therapist's contact is off target. It's also important for the therapist to recognize nonverbal feedback from the client. If the pain produced from a pressure release technique is too much for a client to bear, it is common for them to move their feet or their head slightly in response. A therapist should keep aware of any such movement and adjust their pressure accordingly. The therapist should also be aware that the different clients have different pain thresholds, and their physical appearance offers no clue as to their personal pain threshold. Many therapists have been surprised that their little old lady client can take a lot more pressure than their giant football player client. It's always best to apply pressure gently and not assume a given pain threshold for any client. If a therapist regularly exceeds a client's pain threshold, the client will be unable to relax on the table and their overall treatment will be unsuccessful. In clinical trigger point therapy, we utilize two supplemental techniques to augment the release of active trigger points: tactile distraction and neuromuscular re-education. The tactile distraction technique aims to minimize the referred pain produced during the application of a pressure release technique. The technique involves the therapist using a free hand to apply a surface stimulus to the client's skin lying within the referred pain zone. The most effective type of stimulus is a vibration or a light tapping of the skin. Though the mechanism is not completely clear, it is thought that the stimulation of the vibration or mechanical receptors in the skin acts to modulate the perception of the referred pain. Most clients say that this stimulation takes the edge off of the pain. Neuromuscular re-education is an over-technical name for a simple process. After a muscle's trigger points have been deactivated, it's important that the muscle's normal functioning be reestablished. All this requires is for the client to gently move the muscle through its complete range of motion 8 to 10 times. No resistance other than gravity should be applied to the muscle during this exercise. and the client should be encouraged to focus on the kinesthetic feel of the movement. The purpose of this technique is simply to get the client accustomed to contracting this muscle without expecting the pain to reoccur. Contraindications for the application of trigger point therapy include the following: fever due to an infection or flu, open sores or lacerations, acute trauma. If a client has experienced recent physical trauma, as in a car accident or a fall, be sure that they have been examined by a doctor for fractures and other injuries. Acute radiculopathy, spinal disc injury. If a client has radiating leg or arm pain that is of constant nature, meaning unrelenting pain, advise them to see an orthopedic specialist or a neurosurgeon to be evaluated. Bruising. If a client bruises easily, advise them to see their doctor about this condition before you begin or before you continue with trigger point therapy. Varicose veins. Avoid applying pressure technique directly to the areas with varicose veins, as bruising or vascular damage may result. If you choose to work on fully clothed clients, be sure to ask them if they have any varicose veins. Edema. If a client exhibits marked swelling or edema of the lower leg, avoid pressure release techniques to the lower leg muscles. In these situations, use stretch release techniques to address the trigger points and to enhance local circulation.